If you are over 60, what if I told you that the way you do something as simple as urinating could be putting you in serious, silent danger? It's a danger urologists witness daily. By the time men seek help, the damage is often already done. I am Dr. Richard Powell, a urologist with over 3 decades of experience. Today, I want to speak to you frankly about a common mistake men over 60 make when urinating. This error can have devastating consequences for your prostate, bladder, erectile function, and even your quality of life. You might think that urinating is intuitive and doesn't need instructions. That's precisely where the problem lies. Our bodies change with age. Practices that were harmless in youth can become detrimental later in life. Today, I will reveal the hidden danger in this seemingly trivial act. I will show you how it manifests and, crucially, how to protect your urinary and sexual health before it's too late. Stay with me, because this information could literally change the course of your health. Men your age need to know this. I see it frequently in my practice. Patients arrive with uncomfortable symptoms, fear, and conditions far more advanced than they should be. Many attribute their urinary problems to just getting old. However, in many cases, the issue is worsened by bad habits that have become second nature. The prostate, a small, walnut-sized organ, is central to many of our urinary and sexual challenges as we age. It naturally grows, compressing the urethra and hindering urine flow. This condition is benign prostatic hyperplasia, or BPH. It affects most men over 50, but BPH alone doesn't explain everything. The mistake many men make exacerbates this problem. Consider this. Your bladder is a muscle. Like any muscle, if it's misused or chronically overloaded, it weakens and gets damaged. It doesn't stop there. This habit can also open the door to recurrent urinary tract infections, bladder stones, and even negatively impact your sexual performance. I'm not here to scare you, but to provide clarity and empower you. Information is your best defense against losing masculine vitality. Let's unmask these hidden enemies. I've prepared a list of 4 traps that compromise your urinary and sexual health. We'll start with something that seems harmless, but silently undermines your bladder's health. From there, we'll progress to what I consider the worst urinating habit. This is undoubtedly the most dangerous and widespread among men over 60. It is a true wolf in sheep's clothing. Stay with me. What you learn today could save your kidneys, your bladder, and even your sex life. Before delving into the list, it's crucial for you to understand why we become more vulnerable to these urinary problems with age. Aging simply changes the rules of the game. The prostate, as I mentioned, tends to grow. The bladder muscles, responsible for expelling urine, can begin to lose their strength. The kidney's ability to filter blood also gradually decreases. Think of an old car. It still works, of course. However, it doesn't have the same agility or endurance as a new car. Now, imagine driving that car with your foot on the brake and the accelerator simultaneously. What do you think will happen? Exactly. It will break down much sooner than expected. Many men unknowingly do this to their urinary systems for 50, 60, or 70 years. They expose them to habits that seemed harmless in youth. However, these habits cause small damages, and these scars accumulate. This cumulative effect can lead to serious problems. Furthermore, with age, it's easier to develop diabetes and hypertension. I want to be very clear. These 2 diseases are the leading causes of chronic kidney disease worldwide. They are like 2 hammers relentlessly striking the delicate structure of your kidneys. They can also affect your bladder and sexual function. Therefore, anything that contributes to their onset or worsening is a direct attack on your health. Today, we will name these attackers. To make everything clearer, I've prepared a list of 4 poisons. We'll start with something you neither eat nor drink, but that is equally harmful. We'll then move on to number 1, which I consider the most dangerous and common habit among men over 60. This is the true silent saboteur. Let's begin. Error number 4. Holding your urine for too long. The first poison on our list, number 4, might surprise you. It's not something you actively do to harm yourself. Instead, it's a passive habit that has become convenient. I'm talking about holding your urine for hours on end. You might be thinking, but doctor, what does holding urine have to do with my problems? The answer is everything. Your bladder is a muscular balloon designed to store urine and then empty it completely. However, like any balloon, if you overfill it too often, it begins to lose elasticity and strength. Imagine a waste collection system. If you let trash accumulate for days, it not only starts to smell bad, but also attracts pests and makes cleaning much more difficult. Your bladder is similar. When you hold urine for too long, the bladder becomes distended and under constant pressure. This can weaken the detrusor muscle, which is responsible for contracting and emptying the bladder. A weak muscle means incomplete emptying. What happens when urine stagnates in the bladder? It's like a stagnant pool, a breeding ground for bacterial growth. Urinary tract infections, which are more common in women, can become a recurrent problem for men, especially when the prostate is already causing obstruction. Additionally, constant stretching can lead to the formation of diverticula. These are small pouches in the bladder wall where urine can get trapped, further increasing the risk of infections and bladder stones. The solution: bladder training. The good news is that you don't have to become a slave to the bathroom. The solution is much simpler and accessible to everyone. Don't postpone going to the bathroom when you feel the need. The first step is simply to listen to your body. If you feel you need to urinate, go. Establish a rhythm. If you spend a lot of time sitting in the office or at home, set an alarm on your phone every 2 or 3 hours to remind you to go to the bathroom, even if the urge isn't urgent. This simple action reactivates circulation and prevents overfilling. The next step is to incorporate a regular urination rhythm. Try to urinate every 3 to 4 hours during the day. It doesn't have to be rigid, but this awareness helps keep your bladder in shape. Urinating before bed and first thing in the morning is also fundamental. If you have mobility problems, plan your bathroom access more efficiently. Always have a clear and unobstructed path. Remember, each time you completely empty your bladder, you are flushing out toxins and protecting the integrity of your urinary system. Any movement is better than no movement, and any timely trip to the bathroom is better than holding it in. Error number 3. The misuse of pain medication. We've arrived at poison number 3. This one hides in plain sight in almost every household's medicine cabinet. It's that pill you take without thinking for a headache, back pain, or arthritis. I'm talking about non-steroidal anti-inflammatory drugs, the famous NSAIDs. Names like ibuprofen, naproxen, or diclofenac are familiar to us all. Millions of people use them, believing that because they're sold over the counter, they're harmless. That's the big misconception. While they are very effective for pain, their chronic, frequent, or high-dose use can be lethal for the kidneys, especially in older adults. I'll explain simply how it works. For your kidneys to receive good blood flow, there are substances called prostaglandins that keep the small renal arteries wide open. The problem is that NSAIDs work by precisely blocking these prostaglandins to relieve pain in the body. However, they don't differentiate. They also block those that protect your kidneys. The result is that the kidney arteries constrict, close up, and the blood and oxygen flow reaching them are drastically reduced. It's as if you stepped on the hose watering a plant. The water doesn't reach it, and the plant starts to dry out. The same happens with the kidneys. However, the real danger is the silent damage. Taking these pills every day for chronic pain like arthritis is like stepping on and releasing the hose daily. Over time, the filters get damaged, scarred, and stop working. It's a slow process that shows no symptoms until it's too late. The solution: respect pain and the pill. So what do? Endure the pain? Of course not. Quality of life comes first. The solution is to use your head and, above all, talk to a professional. First and most important, never self-medicate with NSAIDs chronically. If pain lasts more than a few days, the solution is not to keep taking pills, it's to see a doctor to find out what's happening. It's not about silencing the alarm, but about finding the fire. Second, be honest with your doctor and tell them everything you take, including vitamins, herbs, and over-the-counter pills. Many cold or sleep medications contain hidden NSAIDs. Third, there are alternatives for occasional pain. Paracetamol, or acetaminophen, is generally safer for the kidneys, always in the correct doses. Also, explore non-pill options. Physical therapy, heat, cold, or stretching can work wonders and reduce your reliance on pain relievers. The golden rule is this: NSAIDs are potent medications. Using them occasionally is good. Depending on them daily without medical supervision is playing Russian roulette with your kidneys. Error number 2: pushing and straining to urinate. We move on to poison number 2. This is perhaps the most underestimated of all, and the one I see most often in my office. It's a tactic many men use out of habit or frustration, but it is causing progressive damage to their urinary system. I'm referring to the habit of pushing, straining, or forcing to try to empty the bladder when the flow is weak or slow. You might be thinking, but doctor, if I don't force it, the urine won't come out. That's the big misunderstanding. The issue isn't that you can't urinate. It's that the habit of straining, especially in men over 60, worsens the underlying problem and creates a cascade of damage. With BPH, your enlarged prostate compresses the urethra, making urine passage difficult. It's like trying to squeeze toothpaste from an almost empty tube. Naturally, we tend to squeeze harder. Why is this so bad? Your bladder is a muscle, as we've already said. It's designed to contract smoothly and efficiently. When you force it, you are essentially overworking that muscle. It's like trying to lift 100 kilograms with an arm that can only lift 20. Repeating this multiple times will, at the very least, cause exhaustion, and in the worst-case scenario, an injury. Straining to urinate can cause several problems. First, it can lead to thickening and hypertrophy of the bladder muscle. It becomes stronger, yes, but also stiffer and less efficient at emptying completely. This leads to a vicious cycle. A stiff bladder doesn't empty well. You strain more, and it becomes even stiffer. Second, excessive pressure inside the bladder can push tissue outwards, creating the aforementioned diverticula. These are small pouches where urine stagnates, increasing the risk of infections and stones. Third, and most seriously, constant straining increases pressure on the kidneys. In extreme cases, urine flow can back up towards the kidneys, causing hydronephrosis. This is swelling of the kidneys, which can lead to kidney damage. Finally, muscle tension in the pelvic region can even impact erectile function, believe it or not, because the nerves and blood vessels are interconnected. The solution: patience and technique, with medical supervision. Protecting yourself from this poison requires a change in mindset and technique. It's not about being unable to urinate, but about urinating intelligently. The most powerful tool you have is patience. When you go to the restroom, sit down. Many men have a habit of urinating standing up, which can already make complete relaxation difficult. For men with BPH, sitting on the toilet can allow for better muscle relaxation in the pelvic region, which facilitates flow. The prostate is already doing its job of obstruction. Don't help it worsen things by straining. The second strategy is the double voiding technique. When you finish urinating, don't get up immediately. Wait a few seconds, relax, lean slightly forward, and try to urinate a little more. Often, a second jet occurs, ensuring more complete emptying. Never push. Instead, focus on relaxing. Let gravity and your bladder's natural contraction do the work. Third, and crucial, consult your urologist regularly. If your prostate is causing significant obstruction, there are effective treatments that can relieve pressure and restore healthy urinary flow without you needing to strain. From medications that relax the prostate to minimally invasive surgical options, there are many solutions. Don't suffer in silence, and don't use a method that could harm you even further. In a few weeks, you will feel a difference, and your prostate and bladder will thank you. The worst habit: repeatedly stopping and starting the flow, and we've reached the end. We've talked about holding urine, painkillers, and straining to urinate. All formidable enemies. But now I present to you what I consider the #1 habit in terms of danger and silent destruction. It's the most common and most harmful to prostate and bladder health. This poison is not a rare chemical. It's something many men do in an attempt to train their bladder or improve control. I'm talking about the habit of initiating urination and then intentionally stopping the flow repeatedly. They mistakenly believe they are strengthening their bladder or pelvic floor muscles. Yes, you heard right. This practice is often confused with Kegel exercises for the pelvic floor. However, it actually does the exact opposite of what is intended when applied to the act of urinating. In my experience, this is the main cause of a series of complications. Unfortunately, I see them repeated over and over. Patients end up with kidney problems, a weakened bladder, and even erectile dysfunction. Why am I so emphatic? Because interrupting urine flow does not strengthen your bladder. On the contrary, it causes a massive, coordinated attack on several fronts. Attack front 1: bladder overload and muscle injury. Your bladder is designed to empty completely at once. When you interrupt the flow repeatedly, you force the detrusor muscle to stop and then restart. It's as if you were trying to empty a bathtub and someone kept turning the drain on and off. This overloads and weakens the bladder muscle over time, leading to incomplete emptying and the formation of urinary residue. Attack front 2: pressure against the kidneys. Every time you stop the flow, the urine that was already on its way is briefly forced back. This repeated back pressure on the ureters and kidneys can, over time, cause serious kidney damage. This is known as vesicoureteral reflux. In chronic cases, it can lead to kidney infections and kidney disease. It is a direct route to serious problems. Attack front 3: recurrent urinary tract infections. Urine remaining in the bladder after interrupting the flow creates an ideal environment for bacterial growth. Bacteria are not completely eliminated, they proliferate, and you end up developing recurrent urinary tract infections. These are painful, and if untreated, can spread to the kidneys. Attack front 4: nerve disconnection and sexual dysfunction. The nerve fibers that control urination and erection are intimately linked. The habit of stopping and starting can confuse these nerve signals. This leads to discoordination between the bladder and the brain. This can manifest as difficulty initiating urination, post-void dribbling, and yes, in some cases, it can contribute to erectile dysfunction. This is because the central nervous system becomes confused about when to relax and contract. As you can see, it's an all-out attack, which is why I call it poison number 1. The solution: continuous urine flow and correct Kegel exercises. The good news is that we can defeat this enemy. The key is knowledge and correct technique. First, understand, Kegel exercises are important, yes. However, they should never be done by interrupting the flow of urine. Kegel exercises should be done with an empty bladder. You identify the pelvic floor muscles by contracting as if you were trying to hold back gas or lift your testicles. Contract for 3 to 5 seconds. Relax for 3 to 5 seconds. Repeat 10 to 15 times, 3 times a day. This does strengthen the pelvic floor and can improve urinary control and erectile function. Second, when you go to urinate, let the flow happen continuously and naturally. Do not stop in the middle. Relax your bladder and empty it completely. It is an act that should be done without interruptions. Third, eliminate sources of confusion. If you have a habit of training your bladder in this wrong way, stop immediately. Instead, focus on Kegels outside the bathroom and on completely emptying your bladder when you urinate. Finally, embrace your body's wisdom. When your bladder signals that it's full, go. When it starts to empty, let it finish. Simplicity is key. Breaking the chains of this stop and start habit is the most powerful act of defense for your kidneys, your bladder, and your sex life. We have covered important ground. Today, we unmasked 4 silent poisons that threaten your kidneys, bladder, and male health. 4. Holding urine for too long, which overloads your bladder. 3. NSAID pain relievers, which can strangle your kidneys. 2. Straining to urinate, which damages the bladder and can affect the kidneys. And 1. The habit of stopping and starting the urine flow, which launches a full-scale attack against your body. Perhaps you feel a little overwhelmed now. However, my goal isn't to scare you. It's to empower you. The truth, though it may hurt, is the only thing that allows us to make better decisions. Urinary disease does not have to be your destiny. Each of these poisons is under your control. You decide if you go to the bathroom at the right time. You decide if you consult your doctor about your pain relievers. You decide if you urinate with patience. You decide if you permanently abandon the stop and start habit. It's not about changing everything overnight. It's about taking one small step today and another tomorrow. Every small change is a victory. Every conscious trip to the bathroom, every frank conversation with your doctor is another brick in the wall protecting your health. You have the power to change your health story. If this video has opened your eyes or made you think, I ask you to do something very important. Share it. Send it to your children and your friends. Life-saving information needs to circulate. And if you want to continue receiving clear and practical advice to take care of your health, subscribe to the channel and activate notifications. Now I want to hear from you. Leave a comment below and tell me what surprised you the most from everything we discussed. Is there something you didn't know and plan to change from now on? I will read your comments to continue helping this community. Thank you for joining me. Thank you for dedicating this time to what is most important. Remember, your kidneys and bladder work tirelessly for you every second. Return the favor with conscious decisions. I am Dr. Richard Powell, and I sincerely wish you a long, healthy, and vital life. Take care of your organs. Take care of your life. See you in the next video. The Alpha Senior.